And I thought this was a great question that Jen Psaki obviously had zero answers for because it just made too much sense. Roll it, G.
Follow up on Brittany's question about vaccines. Do you think that the White House has had any part in this, in having a sort of maybe pessimistic message towards some Americans who are skeptical of this administration, who for partisan reasons or otherwise, to see vaccinated people in the cabinet or the president continuing to wear masks around each other, or hearing that things won't be back to normal as the vaccine continues to be distributed? Do you think that that is having a negative effect at all?
On people, make sure I understand your question. On people not taking the vaccine?
Yeah, of people who are skeptical of the vaccine and who don't trust the Biden administration.
Well, look, I think, one, we recognize we're not always the best messengers. That's why we're working with these local organizations and groups, because we certainly know that President Biden and Vice President Harris may not be the right voices in a range of communities across the country. Two, we believe that part of our objective is to model public health guidelines, and that means continuing to wear masks, continuing to hand wash, social distance, because there is still ongoing research on what is most effective and how to prevent distribution and the pandemic traveling further. So I'm not sure I'm understanding your question. Maybe.
How do you strike that balance between being a model of the public health guidelines and also not contributing to this sense of hopelessness, perhaps, among people who are skeptical of the vaccine and maybe feel like getting it would not make a difference in their lives anyway?
Sure. Yeah, I think a big part of what we're trying to do is provide accurate information about what getting a vaccine will enable the American people to do. Hence, the president gave a primetime address where he said, when the vaccine's accessible to you and you get it, we can work towards having backyard barbecues. We've also had a number of officials out there to convey, and we've had, obviously, the CDC has put out guidance that says if you're vaccinated, if your neighbors are vaccinated, you can have dinner inside together. It's a pandemic. We don't think it's easy. We know it's difficult. It's required a lot of sacrifice. But at the same time, we're trying to provide accurate public health-based guidance on what people can do once they have taken the vaccine.
Okay. Got it? Yeah, all straight after that answer? Let me ask her question in a more simple way. Her question is, why would anybody want to rush to get a vaccine when if you get it, nothing changes? Nothing changes. You can't go anywhere without a mask. You can't. Now she says, "Oh, you can have dinner." Well, she might want to call the great one, Dr. Fauci, because that's not what he said this weekend. The Stormy Daniels of medicine was out and about in front of the cameras, and he has a different view of that. So they're not even on the same page with that. But I thought that's a great question. If they're so good, if the vaccine is so important, if the vaccines are that effective, which it seems like from all the studying, especially out of Israel, they have been effective. 700 million people now worldwide have either gotten their first or completed whatever doses they've gotten. Israel probably has the best information coming out of it. And some of the studies out of there totally go against what she just said. As far as all of the data so far shows that once you're vaccinated, there's almost 0% chance that you are spreading the virus. You have such little active virus, even if you were to come in contact with it again, that all of the data shows there's almost 0% chance that you spread it. She sits in there today and says, well, we're just, they're still looking at how much you could still spread. No, that's not true. That's not what the data said. Follow the science or not? Which one are we doing? Still, we ask this question.